Hello, and welcome to the community-based organization, non-local public health authority, self-referral process training. My name is Kate O'Donnell, and I am the Safety Net Lead at the Oregon Health Authority Community Engagement Team. Today's training is for community-based organizations like yours. We're going to be talking about the Oregon Health Authority's COVID-19 grant focused on wraparound and support services. We've talked in the previous training about what you do when a person approaches you, the CBO, directly for help, but is not referred by your local public health authority. In that case, we talked about the process and the form you would use to confirm the person's COVID-19 status. But what happens if the local public health authority is not able to confirm the person's COVID-19 status? In this training, we will talk about the process and form you will use to confirm the person's COVID status with the support of your community engagement coordinator. Here's what we'll talk about today. First, we'll start with the language check to talk through some of the terms that I'll be using during the training. And then we'll walk through the non-LPHA self-referral process and forms. Let's get started with our language check. First, throughout the presentation, you'll hear me use the term CBO or community-based organization. That's the term that we use when we are talking about organizations like yours. Usually this means a nonprofit organization that serves community members. You'll also hear me use the term LPHA, or Local Public Health Authority. You may know this entity better as your county public health department. They typically provide things like immunizations, food safety inspections, and reproductive health services. Your local public health authority is the leader in your local COVID-19 response. You'll also hear me use the term CREW, or otherwise known as the COVID-19 Response and Recovery Unit. This is the statewide group that is leading Oregon's COVID-19 response. It's primarily staffed by people from the Oregon Health Authority and the Oregon Department of Human Services. Part of this team includes a group of epidemiologists. These are our COVID-19 disease experts. They help provide guidance and information about COVID-19. And for the purposes of this training, they're also the team who will help us confirm a person's COVID-19 status. We'll also talk about quarantine and isolation. Quarantine means staying away from others when a person has been within close contact of someone with confirmed COVID-19. Isolation is defined as staying away from all other people after testing positive for COVID-19 until the illness has met the definition of resolved, so until the local public health authority tells you that the person is no longer sick. How long does isolation and quarantine last? Typically, it's about 14 days. The local public health authority or the person's healthcare provider will tell the person who is sick or who has been exposed to COVID what the window is that the person should be in isolation and quarantine. Sometimes this is longer than 14 days. And if a person asks for help beyond that 14-day isolation and quarantine period, please reach out to your community engagement coordinator for help. You'll also hear me talk about wraparound support. These are the supports that you provide in that 14-day quarantine period for immediate needs like rent and childcare and food, things that someone needs to stay safe and in quarantine or isolation. This is part of what makes our grant special. We can pay for things to keep people isolated or quarantined for 14 days to slow the spread of COVID-19. You'll also hear me talk about safety net. So these are the existing programs and services that serve Oregonians like SNAP or the Oregon Health Plan. These are programs that were here before COVID-19 and they will be here after COVID-19. Now that we've done our language check, we'll talk through the non-local public health authority self-referral confirmation process and forms. In another video, we talked through the process of how you would confirm a person's COVID status if they came directly to you and not through your local public health department. You may remember that you need to confirm the person's COVID status, so confirming that they have either been diagnosed with COVID or exposed to someone who has COVID so that you can pay for those short-term wraparound service costs. But what happens if you go through that process and you do not hear back from your local public health authority within 5 days? The person may still need help, and you may be concerned about continuing to give them the help they need. We'll talk through that process now. So once again, to remind you when you would use this process, you can use this process if someone comes directly to you and is not referred by the local public health authority. You use this process if you still need to confirm the person's COVID status. And you can use the process if you have tried to reach out to the local public health authority, but they have not responded to your request within 5 business days. So what do? First of all, you've probably already been helping this person with their immediate wraparound needs like food, groceries, rent, or utilities. You can continue helping the person with those short-term wraparound supports and connect them with any safety net programs they may be eligible for. And then you would contact your Community Engagement Coordinator, your CEC. Your CEC will send you a secure email. What do we mean when we say secure email? This is a way to ensure that the information that is sent over that email is not shared with anyone who should not see it. Usually the information contains things like a person's name or birth date or address that should not be shared with a person who should not be seeing it. You would then respond to this email with the person's information in what we call the CREW, the COVID-19 Response and Recovery Unit Self-Referral Confirmation Tracking Form. We're going to start walking through this form now. This is what the form looks like. Again, this is the information in this form that you will send to your Community Engagement Coordinator to confirm the person's COVID status. We'll walk through the different parts of this form. You, as the community-based organization, will fill out some basic information in this form. First, you will fill out the date, the county in which you or the person is located, the name of your community-based organization, and the name of your Community Engagement Coordinator. Next, you will fill out the person's information. So if this is the person who is sick, we also sometimes call them a case. So you would fill out the person's first name, the person's last name, the person's birth date, and the person's address. Do your best to fill out as much information as you can. The information you provide will be used to help our Oregon Health Authority CREW epidemiologist team find the people in our contact tracing data systems. There are 2 other columns in this section under case information that we will talk about later, but that you, the CBO, do not need to fill out at this time. That includes the person's COVID status and the positive test result or symptom date. This is the information that our CREW epidemiologist team will fill out for you. If the person is not sick with COVID, or if you have been in contact with someone who is known to have COVID, you would fill out the known contact information section. So this is the person you are helping has been in contact with. So you would fill out that other person's first name, last name, birth date, and address if known. Again, do your best to fill out as much as you can. The information that you provide in this section will help our OHA crew epidemiologist team find the people in our contact tracing data system. Once you send that information via a secure method to your community engagement coordinator, the CEC will send it directly to our crew epidemiology team. That team will then look within our database and find the person's information. Our team is available to help answer these requests on Tuesdays and Thursdays of every week, and they will work to respond to your community engagement coordinator within 24 hours. Remember, as you wait to get a response from our team, you can continue to provide those short-term wraparound supports. The OHA epidemiology team will fill out the rest of this form. So these are the columns that I mentioned before. If you're helping someone who has COVID, they will fill out the person's diagnosed COVID status and then the date that the person received their positive test results. If you're helping someone who's been in contact with someone who's a known COVID case, the epidemiology team will fill out that person's COVID status and then the date in which they've been in contact with the person you're helping. The epidemiology team will send this information to your community engagement coordinator, and then the community engagement coordinator will follow up with you, the community-based organization, to confirm the person's COVID status. If in this process we find the person does indeed have COVID or is a known COVID contact, community-based organization should continue helping with wraparound support during that isolation and quarantine period. You can also work to connect the person to long-term social safety net programs. However, if our team cannot confirm the person's COVID status, the community-based organization should stop helping that person with the immediate wraparound needs. However, the community-based organization can continue to connect the person to long-term social safety net programs so that the CBO can continue to use grant dollars to fund staff time to help make those connections with existing safety net programs. The point to remember is that we need to confirm a person's COVID status, so diagnosis with COVID or COVID contact, in order to use grant funds to pay for those short-term wraparound supports. This is a complicated process and you may have questions. If you feel like you need help or have questions, your community engagement coordinator is your resource. We are here to support you. Here's a picture of our wonderful team. We are a new team and we're excited to work with you. We're still learning a lot and we may not have all the answers to your questions right away, but we will be sure to find them. And here you can see our community engagement coordinators listed by region of the state. Still not sure who your community engagement coordinator is? You can email our general inbox at community.covid19@dhoha.state.or.us. Thank you so much for your time. We hope this information was helpful for you. We appreciate your time, attention, and all that you are doing to serve your community.